So for me, I started bleeding at 11 weeks. At 11 weeks, I was sitting down, drinking my coffee, watching TV, and I coughed, and then I felt wetness, like just wetness. And I ran to the bathroom and I was bleeding. Hi guys, welcome back to my channel. My name is Iman and this is NICUNurseFaith. So on my channel, I talk about everything to do with NICU, from my experience as a NICU nurse and also as a NICU mom. So if you are interested in that type of content, make sure you subscribe down below. So in this video, I'll be talking about something called subchorionic hematoma / hemorrhage. So this is something I went through when I was pregnant with my son. And when I was going through it, there was like nothing on YouTube. Like I couldn't find any experiences from other moms, or at least other moms telling stories about what this is, the subchorionic hematoma. And I just did my own research. I did my own research, Googled, of course, and I also looked at literature and evidence just because of my background of being a healthcare professional. But I just wanted to find a video where a mom is talking about her experience going through subchorionic hematoma, and that's the reason why I'm making this video. I noticed, based on different Facebook groups I'm part of and different chat groups I'm part of, that this is actually a common, not really common, but it happens, like that the subchorionic hematoma is actually not rare. It actually happens quite a bit. Just it's not common, but it does happen. And so the moms that were asking about this, when I saw that, I just realized that I went through it, and maybe I can share my experience of what I went through, and also at the same time do some teaching of what I've learned and what it is and what to expect. So I just want to make it clear that this video does not replace a medical professional's advice. This video is just meant to give you more education, more support, more knowledge of my experience and what subchorionic hematoma is and what can happen, what cannot happen. So just extra education for moms that are going through it. But this is no way replace your doctor's advice. Always talk to your medical team about any questions you have about your pregnancy, about any bleeding, any concerns you have. I also want to bring hope to moms that are going through it right now, that are going through the subchorionic hematoma, that there could be a good ending. I had a good ending. A lot of moms had a good ending. So just don't give up hope. Be patient and just see how your pregnancy goes. Because thank God my son came out. He was born early, but he came out good, and I almost went full term. So just don't give up hope. Doctors and the nurses will give you the statistics, but there are so many moms that had subchorionic hematoma and did have full-term or almost full-term babies. So just do not give up hope, and just have that in the back of your mind when I'm talking about the statistics as well of what can and cannot happen. What is subchorionic hematoma? So what it is when the gestational sac attaches, so this is a uterine lining, when the gestational sac attaches and this blood starts accumulating in the chorion. So the chorion is where the placenta is eventually going to be created. So when it attaches, so these spots, you start getting blood accumulating when it's attached to the uterine wall. So it's between the actual sac and the uterine wall where the blood is accumulating. So that's what subchorionic hematoma is. It is diagnosed through ultrasound. That's the only way to diagnose it. And usually they diagnose it when the mom's bleeding. Most moms tend to have a lot of bleeding before they go in to be diagnosed. And subchorionic hematoma is actually one of the most common bleeding in the first trimester. That's what I've learned, actually. I did not know that. Some women do bleed the hematoma out, but some women don't really bleed a lot. So it just depends. So you might just have a little bit of spotting, just a little bit of spotting when you have subchorionic hematoma, or you might have more than that, or you might not have any bleeding at all. It happens between 1 to 3% of pregnancy. So it usually starts in the first trimester. and it can actually go longer, which I'll get into, but the bleeding will show up in the first trimester. So for me, I started bleeding at 11 weeks. At 11 weeks, I was sitting down, drinking my coffee, watching TV, and I coughed, and then I felt wetness, like just wetness. And I ran to the bathroom, and I was bleeding through everything. I was wearing a dress, and it actually came through my dress. And we consider that severe bleeding. Severe. I knew it was severe. So I thought I was miscarrying right away. With me, I didn't have any cramping. I didn't have any pain, but you can have pain and cramping when you bleed like that. So I went into the emergency department right away that night, and they did an ultrasound. The baby was fine. There was a good heartbeat. Everything was good, but they saw the hematoma, the subchorionic hematoma, right away, and they diagnosed me with having subchorionic hematoma. With that, once they diagnose you as well, there's different sizes. You can have small, medium, or large. The larger you have, the larger the hematoma, the more of a risk to the baby. So that's why they'll measure and just make sure you ask how big the hematoma is, or your doctor will tell you, but the larger it is, the more risk. So if it is really large, you will be monitored closer, and you would have more ultrasounds if it is really large. So with me, at 11 weeks, I had I would say small to medium. My doctor told me that with subchorionic hematoma, your body will either absorb it or you will bleed out. Usually one of the two. When your body's absorbing, you can still bleed, but just not as much. With me, I was bleeding out. Almost every other day, I was bleeding. More than spotting, but I was bleeding. The other thing is a subchorionic hematoma. When you first bleed, it's bright red. Bright red. It's really scary. That's why I thought I was miscarrying. But as your body is healing, either your body's absorbing or bleeding it out, it turns darker. So even though I was bleeding almost every other day or every third day, more than spotting, it was dark red blood. And it was getting darker and darker. So from 11 weeks to 17 weeks, I bled almost every second to third day, but it was dark red blood. Usually, based on my research, it should not get brighter. You should not have fresh blood when your body is healing from subchorionic hematoma. I had an ultrasound at 11 weeks. I had another one at 15 weeks, and at 15 weeks, it was getting smaller. So my doctor waited until I had my 20-week full anatomy ultrasound. So just talk to your doctor about how many ultrasounds they want you to do. But like I said, the larger the hematoma, the more ultrasounds you have to do, because they want to make sure that hematoma is getting smaller and that baby is safe. So usually with subchorionic hematoma, you bleed the first trimester. But as you get to the second trimester, usually your body would heal and absorb that hematoma, or you would bleed it out. And by the time you get into the second trimester or the middle of second trimester, it does heal. There are cases where some pregnant women actually have subchorionic hematoma throughout the whole pregnancy. And that's actually rare. It's rare to have that, but it does happen. But the more common case is for you to be bleeding in the first trimester and then healing by the time you're in the second or the middle of second. So with me, in my 20-week ultrasound, when I had the full anatomy done, the full anatomy and physical, they looked at the hematoma and it was completely healed. Mine was healed at 20 weeks. So just talk with your doctor of how big the hematoma is and if it is getting better. The more ultrasounds you do, hopefully it is getting better and getting smaller. So just talk with your healthcare team about that. The effect a subchorionic hematoma can have on pregnancy is actually still unknown. There's not much research out there, there's not much information out there of what subchorionic hematoma can cause, what it can do to the pregnancy, like a definite answer. So when I was pregnant and I had that, my OB said, I can either lose the baby, miscarry, I will have an early baby, premature, or I can have a regular, healthy, full-term baby. So it's one of the three options. And they don't really know actually how often each can happen and what the statistics is. So I just want to say to moms that are going through this, do not lose hope, because you can go full term. You can have healthy babies with the subchorionic hematoma. A lot of moms have healthy full-term babies with the subchorionic hematoma. For me, I just had a different problem because my son wasn't growing, and I had a placental problem as well. So he came early at 31 weeks. So I got the premature card, which I'm grateful for, thank God. But it can happen. You can have healthy term babies as well. So just don't give up hope. So there are factors they look at to figure out if your subchorionic hematoma is a concern or not. So usually number one is the size. Like I said, the size is important to know. The larger it is, the more risk it is to the baby, the more risk that the baby can actually detach from the uterine wall and a miscarriage can happen. So they watch you very carefully if you are large. The second is the location. So they will tell you, your doctor will tell you if they're worried if it was a certain location or specific location. The third is the persistency of the subchorionic hematoma, meaning like how long it's there for. If it's there for your full pregnancy, it's more of a concern and they will watch you carefully. But if it has healed, so if it has healed after second trimester, then they're happy and they probably won't send you for a lot of ultrasounds. So it just depends on how long the hematoma is there and how long it takes for it to heal. The fourth is the severity of symptoms. So how much bleeding you're having and how long this bleeding is going for. So usually bleeding starts at first trimester and usually it starts slowing down when you're in your second trimester. And like I said, it starts red and it gets darker. But if you're having bleeding for most of your pregnancy because of the hematoma, then they watch you carefully as well. So those are the four factors that they look at when they look at subchorionic hematoma. So the management for subchorionic hematoma usually is no exercise, pelvic rest, and no heavy lifting. So usually those are the three common advice that your doctor or your nurse will give you if you have a subchorionic hematoma, just so your body can rest. I also wanted to mention that once you do have a subchorionic hematoma and it has healed, they will watch you very carefully. Just because the bleeding is where the placenta is, where the placenta will be created. They will watch you carefully, make sure the placenta is growing, the baby's growing, there's good fluid. So with me, like I mentioned, I had the subchorionic hematoma that healed, and then at 28 weeks, they noticed that my placenta was very poor, like poor perfusion, and my son wasn't growing. So that's when I had to deliver my son early at 31 and 5 days. But they will watch you carefully once you do have a subchorionic hematoma that has healed to make sure everything is going well for your baby. So that's the end of the video. I hope you learned what subchorionic hematoma is or just increase your knowledge about it. I just wanted to provide a video that talks about my experience and share my research with other moms that are going through it. It is scary when you are going through it. It really is, because you don't know what to expect. And usually the people around you don't know what it is. That's my experience. I was the first in my family and my friends to have it. So I hope if you are going through it, I hope this video provides some insight, some advice, some clarity, and also some relief if you're really, really anxious of what can happen. And so just don't give up, have faith, have hope that you will go full term and you will have healthy baby. If you really like this video, make sure you punch that like button and comment below if you have any questions about anything. And if you are interested in this type of content, learning about NICU, having a baby in the NICU, just make sure you subscribe down below. I'll see you in the next video. Bye.